More news now. Milwaukee Alderman Jim Bohl wants to drop fluoride from the city's water. The alderman proposing to use that money saved to create a program that provides dental care for those who can't afford it. Joining us this afternoon to talk more about the specifics of this proposal is Alderman Jim Bohl.
We also have Matt Crespin. He's the Associate Director at Children's Health Alliance of Wisconsin. Alderman, we'll start with you. You're coming out against one of the 10 greatest public health achievements of the 20th century. Why are you doing this?
Well, if you actually look at this particular issue, we're talking about fluoride being an industrial toxin that the Food and Drug Administration has never tested and has never approved for human consumption in terms of its use. We can look at growing evidence of studies that are showing all sorts of adverse health effects coming from fluoride. First and foremost, we have IQ deficits. We have issues with regard to hyperthyroidism, kidney problems, which has led a growing number of organizations from the National Kidney Foundation, the American Cancer Society, and others to actually withdraw their support for the use of water fluoridation. Interestingly enough, in addition to that, we've had all sorts of federal agencies from the CDC raise issues over the increasing rate of dental fluorosis and the use of fluoride for young infants mixed with their formula. We have seen the EPA in 2011 list fluoride on its database of neurotoxicological studies of substances that detrimentally affect the neurotoxicological effect of human beings. So we have all sorts of federal organizations and agencies that have started to recognize the particular concerns.
Alderman, I'm going to interrupt you here because I want to give our other guest, Matt Crespin, a chance to talk here. You've obviously, the alderman is seeing some opposition to this proposal. Mr. Crespin, what do you say to Milwaukee's drinking water not being safe, and the whole issue of cavities in kids?
Well, the issue surrounding this is that there absolutely would be an increase in dental disease if fluoridation was removed from Milwaukee city water. A landmark study here done right here in Wisconsin in Antigo removed fluoride from the city drinking water in the city of Antigo, and after 5 years there was a 200% increase in dental disease. We also have data from some of our partners at a private dental insurance company that insures a vast majority of the residents in Wisconsin, about 30% I should say, that did a look, and in 2011 15% increase in rates of disease in their cities without fluoride in the water.
Matt, a lot of the people coming out against the alderman's position here say that what he just said there is junk science. Do you believe that the things he's citing are junk science?
Well, I believe that there's a big difference between documentation and speculation. And there's been over 3,000 studies on community water fluoridation. And time again, it shows that this is not only safe, but effective, and it's the most cost-effective way of preventing dental disease that there is.
Alderman Bohl, you say you want to use that money and help underprivileged with dental care. Do you think doing that, using the money saved, will actually prevent cavities and dental decay? Well,
first and foremost, I think that we have to kind of get back to the issue that was just discussed here, and that is a comparison of communities that fluoridate and don't fluoridate. The 98% of Europe and fully almost 40% of the United States does not fluoridate. In fact, even in the Metro Milwaukee area, we have numerous communities from Brookfield, Lannon, Sussex, Muskego, and others that do not fluoridate. The very studies that he cited, actually, there are numerous ones that are more recent that run counter to that. In community studies after community studies, in national studies of communities that fluoridate versus those that don't, there has been no shown difference in the rate of dental caries, and in fact, the very communities that have actually eliminated water fluoridation, which includes about 350 in the United States and Canada in the last 10 years, have actually showed a continued decrease in the rate of dental caries. However, interestingly enough, even in the communities that do fluoridate, like the city of Milwaukee, what we tend to find is a very high rate of dental fluorosis, or a poisoning of a overexposure of fluoride in teenagers that has been evidenced with a dramatic increase recognized by the CDC. Yeah. And ultimately, what that winds up showing is that, one, we have too much exposure in certain communities that already fluoridate. Two, the rate of dental caries or cavities is even greater in those communities,
Okay,
even though
Alderman,
they do fluoridate.
I'm going to have to cut you off there. I'm sure you could go on for quite a while. And thank you for joining us, and Matt Crespin as well. And I'm sure if you use the Google, you can find a lot of information to support both sides of this argument.
And you can
well.
still join the conversation. Just go to our TMJ4 Facebook page and post your comments. We're back after the break.